Hello, my name is Dr. Hillel Mazansky and I specialize in medical hypnotherapy, guided imagery, nutrition and exercise. My website is dr for drmedicalhypnosis.com, upon which there are your personal health hypnosis videos. Today's health tip is entitled 7 Pains You Should Not Ignore. We all at times have aches and pains, but if a sudden, different, new pain develops, then you must take care of it immediately. The first is a severe headache, one that is unlike anything you've had before. Even if you suffer migraines or sinus headaches or muscle tension headaches, if this headache is different and is severe, you must go immediately to the emergency room because it could herald a ruptured aneurysm, which means a ruptured vessel in the brain, and that can give you a brain hemorrhage which can be lethal. So if you get a severe unexplained headache, immediately 911 to the emergency room. The second type of pain is if you have acute chest pains. Mainly on the left side, the pain can go up the throat to the jaw or even down between the shoulders. That can herald an acute heart attack. If you start getting pains while walking or exercising and you get chest pains, that is considered angina and it should be taken care of immediately to prevent a heart attack. But a sudden onset of severe pain with nausea and vomiting in the chest that radiates to the jaw or to the shoulders should be taken seriously, as this may be a heart attack. Females tend to get the pain more in their epigastrium or the upper portion of their abdomen rather than in the chest, and sometimes they even diagnose it as indigestion. Well, it turns out that it's not indigestion, it's actual fact a heart attack. The next is sudden onset of severe pain between the shoulders or in your lower back. And the one thing that we're all concerned about, while it could be also a heart attack, but if it's more severe, it could be a ruptured aneurysm. An aneurysm is like a balloon in your artery. And if it comes in the upper or lower back, it could be a thoracic or an abdominal aneurysm that has burst. And then you bleed into your abdominal cavity. This is serious and life-threatening and should be seen immediately. The next is acute abdominal pain, sudden onset of severe pain. And if you still have your appendix, it's highly likely to be an attack of an acute appendicitis, but also acute attack of gallstones in the upper abdomen can be serious. The next is pain, sudden onset in your leg. Usually it's in one leg only and the leg gets swollen. That can be a deep vein thrombosis or a clot in your leg. Now that in of itself, while it is dangerous, is not as dangerous as if a piece of that clot should break up and then go to your lungs and land up in your lungs as a pulmonary embolism. That is serious. So if you notice that you have one-sided, unilateral on one side of your legs are swollen and painful, see a doctor or go to the emergency room immediately for treatment. If it is a clot, you will need to be on blood thinners to prevent it breaking off and going to your lungs. The next thing is burning in the feet or the lower legs. That is called neuropathy and can herald diabetes. Sometimes people do not know that they have sugar diabetes, and it presents with a burning in their feet and a neuropathic pain. And they must be seen immediately to get the blood sugars controlled. No pain should be ignored, but these different types of pain that I've recommended should be taken seriously. Also, females who are depressed tend to have pains that are vary in place, in variety, in type, and what have you. But if they have a sudden onset of a different type of pain, it should not be credited to their depression, but should be taken seriously. Those are the 7 tips for pain that you should not ignore. My name is Dr. Hillel Mazansky, and I thank you for listening to the Health Tip.